What's taking place in India is more than a second wave. It's a tsunami. Reported daily infection rates are the highest ever globally, and all experts agree the actual numbers are far higher. In the capital of Delhi, COVID is killing one person every 4 minutes. Car parks have been converted to mass crematoriums as a national shortage of oxygen causes even the young to die.
We have young patients who will die in a matter of 2 hours. I request you, please send oxygen to us. We need oxygen for our patients.
India's out-of-control crisis is a national tragedy, but as the world's largest vaccine maker, it's a catastrophe globally. 92 developing nations rely on India, home to the Serum Institute, for the doses to protect their own populations. Their critical supply will now be crippled by India's domestic obligations, an outcome that the African Centre for Disease Control and Prevention called catastrophic. India has the capacity to manufacture 70 million doses a month, but even with all of those doses directed towards its domestic needs, there is still not enough to meet its overwhelming demand.
Globally, the COVID-19 pandemic continues to intensify.
The world is on track to record more COVID-19 deaths this year than it did in 2020. According to the WHO, while 1 in 4 people in rich countries have received a vaccine, only 1 in 500 people in poorer countries have received a dose. The risks of allowing second-wave outbreaks to ravage places such as India aren't limited to those countries alone. Emerging variants from these zones only risk deadlier and faster spreading outbreaks in other regions. Despite efforts to restrict the spread of India's new variant, B.1.617, it has already been identified in at least 10 countries, including the United States and Britain. Further delays to more equal global vaccine distribution will affect everyone, including vaccinated populations. This fear was made resoundingly clear by the Biden administration, who have now announced they will share 60 million doses of their AstraZeneca vaccine with other countries in desperate need.